Microbicides are products that have the ability to prevent the sexual transmission of HIV and other sexually transmitted infections when applied topically to the vagina or the rectum. A variety of microbicides are in development, and they could be delivered in many forms, including gels, creams, suppositories, films, sponges, or rings, and many of these are being researched now. These products would be applied topically to the vagina or rectum or inserted like a suppository into the vagina or rectum to prevent infection with HIV and other sexually transmitted infections. 6 first-generation microbicides did not show any success in preventing HIV infection in clinical trial. In fact, 3 of the microbicides may have increased the risk for acquiring HIV because of damage caused to the vaginal mucous membrane. All of these microbicides were used vaginally by women. Currently, there are no first-generation microbicides in large-scale clinical trial. Researchers are now looking at a second-generation microbicide that contains HIV drugs. HIV-based microbicides can be considered a type of pre-exposure prophylaxis, or PrEP. They would be more expensive than the first-generation microbicides and carry additional risks such as toxicity, side effects, and potential drug resistance. Although the focus thus far has been on vaginal gels, a tenofovir gel specifically formulated for rectal use is also in development, although it has not yet been evaluated for its effectiveness against HIV infection. No microbicide has been approved for use in any part of the world. There are many types of vaccines, but all generally work by teaching the immune system to recognize and eliminate a disease-causing microorganism. Some vaccines are designed to help the immune system prevent an infection, and these are called preventive vaccines. Therapeutic vaccines are designed for people living with HIV and would work to stop the virus from harming the body. Therapeutic vaccines are not a cure, however, they will boost the immune system and reduce the reliance on HIV medications. Protein vaccines are natural substances. They help build and maintain your body, and they do the same for viruses, such as HIV. A protein vaccine may be made up of tiny lab-made pieces of proteins that look like pieces of the HIV virus, a peptide vaccine. Or it may be made of bigger pieces, a subunit protein vaccine. These proteins do not actually come from the real HIV virus. It is like using a photocopy, not the original. After vaccination, the body's immune system may respond to the proteins in the vaccine. If a vaccinated person is exposed to HIV in the future, the immune system may recognize the same proteins in HIV and fight the virus. DNA vaccine uses copies of a small number of HIV genes which are inserted into pieces of DNA called plasmids. The HIV genes will produce proteins very similar to the ones found in real HIV. After vaccination, the body's immune system may respond to the HIV-like proteins and fight the real virus if the vaccinated person is later exposed to HIV. A viral vector vaccine is a carrier vaccine. Just as a plane or truck delivers its cargo, a vector carries genes copied from the HIV and delivers them to the cells in your body. For a viral vector vaccine, non-HIV viruses are used to carry genes that tell the body to make some HIV proteins. These viral vectors don't cause disease in people. The genes are inserted into the vector, which carries them into the body's cells. Then, as with a DNA vaccine, the HIV genes will tell the body to make proteins like the ones found in real HIV. After vaccination, the body's immune system may respond to the proteins and fight against HIV if a person is infected in the future. Currently, there are no effective HIV vaccines of any kind. So what is post-exposure prophylaxis, or PEP? Post-exposure prophylaxis is taking a combination of HIV medications after possible exposure to prevent possible HIV infection from occurring. In Alberta, this treatment option has limited availability, used most often for occupational exposures such as a needle stick injury or for persons who may have been sexually assaulted. Under these conditions, PEP is covered by Alberta Health Insurance. The treatment must be administered within 72 hours of exposure to be effective in preventing possible exposure to and infection by HIV. It is a combination of antiretrovirals and protease inhibitors taken for 28 days post-exposure and may come with some side effects, including headaches, nausea, diarrhea, and fatigue. Treatment as prevention is also known as HIV prevention intervention. It is currently approved HIV treatment medications known as antiretroviral therapy, or ART. ART works to reduce the viral load, or level of HIV virus in an infected person to what is known as undetectable level. Undetectable is not a cure, but it means the virus is well controlled and at very low levels. The result of an effective ART treatment is that a person living with HIV can see improved health outcomes and look forward to a long and normal lifespan. ART is available only to persons who have been diagnosed with HIV. Studies and trials have shown that people living with HIV who are on effective ART are up to 98% less likely to transmit HIV to a partner as a result of this reduced viral load. Less virus in body fluids means less possibility of HIV transmission. So what is pre-exposure prophylaxis, or PrEP? PrEP is the taking of an approved and recommended HIV treatment medication to prevent acquiring HIV infection if exposed to the virus. Extensive research over several years among key populations affected by HIV has shown PrEP provides up to 99% levels of protection against HIV when taken daily. In 2012, the US FDA approved and recommended Truvada as a prevention option for HIV-negative people to reduce their risk of HIV infection. This approval and recommendation also included a statement that regular condom use remain as part of individual behaviors to prevent HIV infection. In 2014, the US CDC made their recommendations on who else could benefit from PrEP as an option for preventing HIV acquisition. Updated guidelines for prescribing, use of, and follow-up care required for anyone using PrEP were also released at the same time. In 2014, the World Health Organization, or WHO, followed with similar recommendation and updated guidelines for persons who could benefit from PrEP. PrEP is not a cure for HIV. So, we have the tools available to reduce the risk and prevent HIV infections. So let's use them.